Welcome back to this second episode of the MedMind Roundtable at HubMed ED, and it is a pleasure to see you all again. And because we have new users and peers that are following us now, I want first to introduce the panel of experts that we have here today to talk about a new topic. First, I'm Dr. Juan Sopena, dermatologist with more than 20 years of experience in the field of aesthetics. And start introducing yourself, Isa.
Yeah, my name is Dr. Izabela Kobylińska. I am certified dermatologist and I am based in Poland. I run my own clinic in Gdańsk and I have experience with aesthetic medicine for more than 20 years. And I am so happy to be here with you, my colleagues.
Seems that you and I are the oldest, huh?
Yeah, it seems like.
Maya?
Thank you so much. My name is Dr. Maya Sinai, and I'm a dermatologist and Mohs surgeon. So I have a clinical practice where I'm also seeing my aesthetic patients and my surgical patients together. I've been doing this since 2015. So how much experience do I have?
A lot.
Not
A
a
lot.
lot.
You actually have a lot in such a short time. Dean?
Hi everyone, I'm very pleased to be here. My name is Dean Berman and I'm an aesthetic doctor. I have give or take 17 years of experience in doing what we like to do. In addition to being a physician, I also work in our industry for some major players, and I'm very happy to share my experience with everyone.
Dr. Shilemba?
Hi everyone, my name is Evgenia Shilemba. I'm a dermatologist. I'm from Kiev, Ukraine. I have more than 10 years of experience in aesthetic dermatology, and cosmetology and aesthetic dermatology is really my passion, and I always try to combine clinical experience with some new scientific knowledge. That's why I'm here to share with you and also to learn from my colleagues.
Thank you so much. And our plastic surgeon, Dr. Cohen.
Hello everybody, so my name is Sarit Kwan. I'm a board certified plastic surgeon. I'm using facial aesthetics, both surgical, from the surgical perspective, and also from the minimally invasive procedures. I'm also fond of academy, so I'm publishing a lot of scientific papers. And
that's why you're here, because of your expertise, yeah? And our neurologist, Martina.
Hello, my name is Dr. Martina Blaho. I'm a neurologist from Austria, from Vienna, and I'm doing neurology now for many years, and I always loved using toxin for medical indications. And since a while, I'm also like to expand the field to aesthetics, so I'm now very happy that I combine those two specialties.
Thank you everyone for being here. And as we promised you in our first episode, we are diving into the most important and interesting topics in the field of facial aesthetics. And today, being a dermatologist, I think one of the most important ones is actually the radiant skin. And we're going to decode the secrets of skin quality, because we all know that the request for a luminous skin is universal. You know, I think all of us come from different countries and we all get this request from our patients. Nah? So let's explore all together a little bit this multifactorial, skin quality treatments and protocols.
Juan, that is so true. I think it all starts with a really comprehensive medical history. So we always need to understand our patients, to understand where they are coming from, which treatments they had in the past, where they are at the moment, how we can help them, and how we can take them to the next level based on their history.
Yes, Dean, I really agree with you. And the comprehensive medical history is a cornerstone, but I think that it is vital to employ the modern tools, such as dermoscopy, for example, to gain the in-depth understanding of the skin condition, and not just to treat the symptom, but really reach the root cause of the skin condition. I also use in my practice the high-resolution ultrasound, because it allows to measure the skin thickness. It allows us to measure the collagen intensity score and, for example, to see how much the skin has improved after using collagen stimulator treatment. And it helps in the communication with patient because I can show them how much their skin has improved. And it comes to the next level of working with patient, to come to the understanding of a patient as a person. What is their motivation for coming to me? What is their desire? What is their fear and hesitation sometimes? Why did they come to me as a professional? And this is the holistic approach.
Right. I used to say that, the skin quality is so important, and I used to compare it with the decoration of a nice house. You might have a house with a great basement, nice columns, a very fantastic roof, but it's the decoration at the end what makes your house beautiful or not. This is a little bit the same with skin quality. You can have a good structure, good support, good projection, but actually at the end what we see from outside is actually the quality of our skin. But we have so many products, portfolios, devices, technologies, such a big options in the market that sometimes it's difficult. How do we create this ultimate rejuvenation path for each individual? Who wants to start with this question?
Well, I'd like to start. I think it's really important in my clinic because I also see my surgical patients, patients coming with skin cancers or precancerous lesions, lots of sun damage, farmer skin. When they come in with a specific lesion. And when I start to look at the lesion and I start to look at the skin around and I'm explaining to them where they lie on the spectrum of sun damage and skin cancers, we start to talk about skin quality. And I get a lot of crossover with the patients that I'm also operating on that come eventually for aesthetics, men and women as well. And I think it's really important to give them that kind of holistic approach to the skin quality, not just for the aesthetic reasons, but also for the health reasons that come with it. Because when you're healthy and treated, the skin is radiant and beautiful at all ages. And I think that anyone can achieve the skin quality improvement.
Isabella, you wanted to say something?
I have a point also. I think it's a very important thing that we can meet everybody with our colleagues and experts together at this platform, because this is the point, the skin quality we can learn from dermatologists, because especially young doctors who are coming to aesthetic medicine, not from dermatology field, but from other fields. They very often, they don't know the answers. They see the skin quality needs to be improved, but they don't know how to do it. And to find, comprehensive, fast information is very, very difficult. So to have the platform like HubMed, you can ask, you can discuss, and you can answer your questions, for example, about skin quality with experts, with dermatologists.
Right. I think it's very important to, in the field of skin quality, define a little bit what would be our priority. Is it like the fine lines, or is it the pigmentation because we have solar lentigos, or maybe the redness because of telangiectasia, or even in skin quality we can talk about the firmness of the skin. So I think that's very important. How would you start? What would be your first initial, treatment plan or protocol for that?
I think that today we can look much deeper and much more interesting and appealing way to the patients. Because what I like to do, I like to ask my patients to come with photos of their parents, mother, father. I want to see how they looked in the same age, and I want to kind of predict the future by analyzing the history of the family. And I think that we will all agree that today's 40, is what in the past was a much older age and so on, because the improvement that we can achieve today is tremendous. We can create skin quality in, as Maya said, in 20-year-olds or 40-year-olds, 60 years old, which will look much younger than their real chronological age.
just dealing only with the skin quality.
Exactly.
Which because if the skin reflects light, it looks young, it looks healthy.
Yeah. We all know that skin is an indicator of diseases, of body diseases. So when we have all sorts of body problems, our skin will show those signs as part of the illness. And sometimes we will diagnose diseases that are not necessarily related to the skin by looking at the skin. But today we are using this fact and those wonderful products that we've got in order to improve skin quality really into a new world.
I also think that it's very important to educate our patients, because very often they come to our offices and they want to, for example, lip augmentation. They don't even think about skin quality. So to get the knowledge about the skin quality and how to improve the skin, it's also very crucial.
I think skin quality, has been, it's of such an importance that even treatments that were not, launched for that purpose actually have shown a fantastic result on improving skin quality. And this is the case of the neurotoxins. And this is why we have you here, Martina, as a neurologist, and you have a unique perspective on neurotoxins, but can you share with us your insights or your thoughts about how does these neuromodulators influence the skin quality?
Yes, actually, neurotoxin, when used cleverly and wisely, can significantly enhance skin quality. It's like microdose; they can decrease pore size and improve skin texture, and leading to refinement of the skin surface. So the key of those treatments is to complement the natural skin quality and the natural skin features, not to overpower them. So it's like a delicate balance that, when you use correctly, reveals the true potential of neurotoxin skin rejuvenation.
Yeah, we all know about this famous baby, toxin, or the microtoxin. This is something that it's really trendy and people are using it. In my personal opinion, I think it works really fantastic to improve the skin quality. Not only improves, the fine lines and wrinkles and stretches the pore, but also you reduce the sebum production as well, and it gives a fantastic luminosity when you use it in low doses.
For example, when I discuss neurotoxin with my patients, I always try to emphasize the benefits beyond wrinkle reduction. So I try to explain how Botox can contribute to overall skin quality by leading to a more rested and youthful look. So it's about talking about the expectations and also explain the patients about the good effect of the cumulative benefits of neurotoxin. So I start with a more conservative approach, and then I slightly start graduating the treatments to achieve the desired outcomes.
To treat, for example, rosacea, it's a changing stone in our field, in dermatology, because it gives the real improvement in very, very fast time. So this is one of.
Yeah, definitely. I would insist that when we do this, we have to be extremely superficial, not to have
Yes.
Yeah, very, very important. And also, we also said that we are focusing on combined treatments. And about this topic, because I have my own experience, I do create my own mixture and cocktail. I call it the Sopena cocktail in my clinic, where I use a low dose of neuromodulator of toxin with, cross-link HA, and sometimes with a complex of vitamins and amino acids. Do any one of you have a experience combining the toxin with any other product or device?
I like to combine the neuromodulator with the amino acid and with low molecular weight hyaluronic acid, because we can inject it more superficially than cross-linked hyaluronic acid, because it will not leave any papule on the face. And it really helps to improve the skin surface, to reduce the fine lines. It helps because it approaches the level where the muscles attach actually to the skin. Also, it helps to reduce the skin oiliness, even to treat the moderate and light degree of acne. And also it helps with the rosacea symptoms, because amino acids improve the elastin in the capillary wall. And the hyaluronic acid stimulates fibroblast to produce more collagen, elastin, and hyaluronic acid. So it's kind of improvement of the extracellular matrix together with the action of neuromodulator. It gives fantastic results.
Thank you for your insights. Dean, you were going to say something. Do you mix it with something else?
In general, not just regarding neurotoxin, I think that when we understand the combined treatment, when we understand the mechanisms of different products, we can really achieve beautiful results. So I'll give as an example that I really like to do in the clinic with EBDs. Okay, when we combine, for example, biostimulators, EBDs, such as lasers, for example, I can achieve beautiful results of really resurfacing the skin and to give a glow and luminosity that was really lacking. And this is something that before people weren't even willing to talk about. And today it's part of our daily practice. And I think this is something that we all like to share. I think that every time that I meet anyone, Maya, Tina, Evgeny, it doesn't matter, we talk, we exchange our experience and what has happened in our clinic since our last meeting. I think that I know some of pictures of patients and their journey because I was involved without them knowing in how to improve their self-being.
I remember I was injecting cocktails for mosotherapy with vitamins, and they didn't last a long time, right? Because we inject and they work for, not for a very long time and they're gone. But when we combine them with cross-linked hyaluronic acid, we have this situation that this cross-linked hyaluronic acid stays longer. So you can put other things and to wait for longer lasting results.
What wonderful insights here. But before we move on, how do we propose a patient a treatment plan regarding or to improve their skin quality? Sometimes it's difficult, because sometimes you don't have an immediate, great result because it needs, a few sessions. Or how do you actually, create this treatment plan or convince the patient, to do this treatment plan? Maya.
Yeah, I like to talk to my patients and get them involved also in the process in deciding what we're going to do for the skin quality. I like to break it down into two parts so that we have a treatment plan that we're going to do right now for their skin quality, whether it's a series of treatments or something like that. And in between treatments, we have a maintenance treatment so that they have something that they can do at home, whether it's using a retinol at night. I really like to use that with almost anything that I'm doing on the outside, whether it's an energy-based device or injection. I think it's really important that we have that maintenance treatment, and then we have the also series of treatments for skin quality. So when I speak to them about that, I get them involved and I educate them to know that skin quality is not this one treatment thing. It's not surgery and then you have a result. It's something that you have to work on and you improve slowly, because as we kind of damaged our skin and our skin quality throughout our life with sun and other things in the environment, so we can slowly build that back up and get a really nice skin quality and really good natural results that I think anyone would be happy to have.
I think I love your point about also the treatment plan at home and the topicals and the cosmetics, because I do believe as a dermatologist that they do play a role, maybe not as a first-line treatment sometimes because the condition is more severe, but definitely as a maintenance. And this links to our next question or my next question that I want to ask to the panel is Dean, for example, how do you deal with this need of an immediate result when we have this patient is, oh doctor, I have a wedding in 3 weeks or something like that, and or they really want to see an immediate result, when we know that sometimes this kind of treatment takes a little bit longer with a number of sessions?
It will all bring us back to medical education. So medical education is education for us, but it's also patient's education, because when we are honest with the patient and we explain to them the processes that will happen, they will understand it much better. Of course, I tend to give them something that gives immediate results to begin with. So if I'll give an example, I will create cheekbones or chin or lips that they will get an immediate effect. And the additional treatments like EBDs that takes more time in order to see the results, I will do as well. However, I will explain to them that they will kick in, so to say, or you will see the clinical results, and that might take 3 months or so. But the combinations of both of them, the fact that they have something immediately to see and to enjoy already now, and something to look forward that's exactly the patient's education that I was talking about. And I can say very proudly with my experience that the patients love that.
I think that's the clue. It's patient education. Sometimes it's not medical education for
Exactly.
doctors. In this case, it's patient education. And you wanted to say something, Dr.
Yeah,
Farhan?
I absolutely agree with you, Dean. The aim is to create a transformative journey for each patient where each treatment complements naturally the other one. So in that way, we culminate in an enduring skin quality and a radiant flow. And it's not just about the treatment themselves, it is the why that we have to explain to our patients, because each skin enhancer has different target, different goal. So if we think about it, it's not can be only a skin superficial. So this is like lasers and so on. And others are working for the other extracellular components, extracellular matrix components. So elastin and collagen and the glycosaminoglycans and hyaluronic acid. So it should be based on patient needs, and we should take into consideration that all the extracellular elements are getting deranged with aging. So we should take an holistic approach like we were talking.
Yeah, fantastic insights. So let's dive into the heart of the matter. I want to know your secrets, guys. Come on, tell me, what are your secrets to get that radiant look, that luminous skin? You know, what are your secrets? What are your best tips that you can tell us about it?
If the patient comes first to my office, almost every time I start with peelings. I would like to educate them and to start with peelings to improve the skin color and the skin quality. And then the next step, usually I suggest biostimulators to produce more collagen. So I'm going layer by layer, which is very important. And for this approach, I need to educate my patients. I need to spend time with them. They need to understand that this is a process, that this is aesthetic medicine, so we need time. So this is what I do. And then the next step, energy-based devices, injectables, toxins, everything together, but the skin quality first, layer by layer.
Maya?
It's a really good question. It's hard to answer specifically because I think that every patient that comes into the office comes with his own story, his own motivations for coming. I had a patient just this week who I think she made an appointment maybe 3, 4, 5 times, canceled every time. She was so nervous about coming in. She didn't want to look like her mother, but she didn't want to do anything too crazy. And she finally made it. She came to the appointment and we spoke about it. And I had to tailor what I usually like to do for her because everything is different. Of course, in an ideal world, I would like to do everything to everyone and have amazing skin quality for everyone. But it's really hard to get that when not everyone is willing to have bruising, not everyone is willing to be peeling for a week. A lot of people are very scared about needles and don't want any pain or anything like that. So it's really hard to say what exactly is my protocol. I like to keep the patient always at the center. Never do anything that the patient doesn't want. But if in an ideal world, I would absolutely use a combination of everything for everyone. It's just the dosages and the mediating between which ones I do is really, I like the patient to decide with me.
I think you're right, because at the end, what we are saying here in HubMed ED is that we always individualize our treatment, so it's going to depend not only in the anatomical, features of the face of the patient, but also in the downtime, that they are, allowed or they are expecting to have economical issues, budget related. So there's so many factors that, I don't know.
If I can answer the question, if I had to pick one thing that I like the
tip
most
that I
about,
that's the one that I want.
I probably say that biostimulators are a total game changer. When I started out in aesthetic medicine, I had a different way of approaching skin quality, and now that I have biostimulation, I am able to give so many more patients that natural look for long lasting, and I think that it's really the best thing for skin quality in my clinic.
Yeah, but
I agree.
Yeah.
this is a very good point, because also for the biostimulator, we have various biostimulators and each has its own advantages, and it should be tailored in accordance to their patient needs. So some biostimulators, like the biostimulator refillers, they are excellent for the immediate plumpiness. However, there are real biostimulators are for the long-term and more gradual effect. So it should be kept in mind that we should customize our treatment in accordance to the patient needs.
And for those doctors that maybe are not that advanced to use like biostimulators, they can still improve skin quality. You are a super fan of peptides, Dr. Shelemba. Yeah. Would you consider these peptides as your first line or choice for skin quality improvement?
For me, the first line of choice depends, first of all, on the patient age, and it's again about the personalization. Like for the younger patients, as Dean said, we need some kind of a magic treatment first to make them believe us and then go forward to do the treatments that have delayed result. For example, do the neurotoxin in the beginning or do the filler, lip filler or chin filler, to make like that seeked for Barbie look. But if it's an older patient, I always think about the like popular topic now, which is the extracellular matrix, because we know that aging of organism and of a tissue is to a high degree aging of the extracellular matrix, which surrounds our cells, fibroblasts, from which they get the nurture, from which they get everything and send signals to each other. So I know that in older patients, the collagen degrades and there is no place anymore to produce new collagen. So first of all, I try to break that old collagen by using energy-based devices, like for example, high-intensity ultrasound. Then macrophages kick in. They go through the stages of catabolic reactions in skin, and then that's when I use bioidentical peptides and amino acids, because bioidentical peptides stimulate fibroblasts to produce new collagen and elastin, and amino acid is a building block from which collagen and elastin is being produced, and it gives fantastic result, and it can help to change the entire patient story from what they had before they come into the office and what they get after like few months only. But we really need to convince them about the treatment plan.
Correct. Isabella?
Yeah, this is also another situation that we can combine treatments. Like we can use peptides and not cross-linked hyaluronic acid to moisturize the skin, to prepare the platform for example, PLA. And then the second step would be the PLA. And together, PLA and those peptides and hyaluronic acid, all of those factors are, working with fibroblasts to boost fibroblasts. Yes, they support each other.
Any other insights about the skin quality?
I want to share with you my secret.
Okay, yes. Tell me your secret, Dean.
I'll tell you many secrets, but my secret is that I have no secrets. My secret is that I'm here because I want to learn from others. I'm here because I want to share what I know, because there's no black and white in aesthetic industry, okay? There are so many shades of gray here, and we, as Maya indicated before, every patient is different. Every patient is individual, and we have to tailor-made the exact and correct treatment in order to achieve the best results for them. And I cannot do it on my own. You cannot do it on your own. Isabella cannot. We are doing it together. We're here to share, and I think this is the beauty of the platform, that we combine forces in order to improve ourselves constantly, and by having no secrets, we improve the well-being of all of our patients.
So thank you very much for sharing your secret this time.
And I think that also we can invite our colleagues that started, following us to share with us
definitely,
the
Isabella.
experience.
I think HubMed ED actually is more a community where we actually want to share, even with you guys. I mean, we want to have your feedback also and we want to know what you think, what are your options, and because as we said before, we also learn from you, and this is a platform where we all share our expertise and actually learn from each other, and you could teach us as well as we can share our protocols with you. I think, as you have seen, skin quality is a very interesting topic. I'm sure that in the very near future, we will have a specific section where we will cover in detail all these protocols and different possibilities of treatments and combined treatments and therapies. And I want to thank you again, all of you, for being here in this second episode of the MedMind Roundtable. And please recommend us to one of your friends, your doctors, because they're going to miss very interesting topics in our next episode, Roundtables at HubMed ED. Thank you.